Should we start?
Yes.
Perfect. Okay, good evening, everybody. So today, inshallah, we'll be having two back-to-back lecture. So don't feel stressed out. It's not a lot of slides, and content, inshallah, going to be very easy, straightforward. So we might finish the first lecture, and then I give you like 5 minutes break, and then do the others. So I don't think we'll use the full 2 hours. So we'll start with the first subject, which basically talks about the fascia that cover the neck. And then we are going to talk about two triangles. First triangle we're going to talk about is the posterior triangle. And then in the next lecture, we'll be talking about the anterior triangle. So first of all, let's talk about the fascia. I'm sure that you took histology course and you understand when I mentioned the term fascia. So basically, fascia mean a fibrous tissue that surrounds either muscles or vessels or nerves. So basically, it's like a covering tissue. And in the neck, we have multiple layers or different fascia that can act as a support and then divide the neck into different structure. And it's very important. So subhanAllah, God made these fascia to minimize the spread of infection from one area to another. So we'll look at this fascia. If you look at this cross section and you see the different colors here, you see that there are different colors. So the first more superficial layer, you see this with the yellow color, is basically called the superficial fascia. So this is the very most superficial fascia that covers the neck. And after that, you have some fat layers. And after that, you have different layers. We call them the deep cervical fascia. So the first one that covers everything, or everything deeper to this superficial fascia, the first one is the green one. You can see it, it's enwrapped the whole neck. And this is called the investing layer. And after that, we have 3 other layers. And they are named according to the area. So you have one closer to the neck or trachea region, we call the pretracheal layer. So this one is around the pretracheal region. And then there's another one, we call it prevertebral layer. So this is around the vertebra. This is called the prevertebral layer. And there's another one, we call it the alar fascia or carotid sheath. So this is covering the carotid artery. That's why the name, and also covering the vagus nerves and the jugular vein. So that's why the name is coming from the carotid artery. So these are the fascia that covers the neck. So we'll dive deep and talk briefly about each one of these layers, because it's very important landmark in the neck. And also, as I said earlier, it helps you to prevent the infection from traveling from area to another area. So the first one is the superficial fascia. And this is just deeper light between the dermis and the deep fascia. If you look at here, so this is the dermis and this is the deep fascia. This is where the superficial fascia lies. And what's the content? Basically, it has some nerves, it has some veins, it has lymph nodes, it has fats, and it has very important muscle. This large muscle, it's called the platysma muscle. And some people refer to it as the shaving muscle, because when we shave, we stretch our neck in order this is very obvious for the male when they want to shave their beard. They want to stretch the neck so that it's just very easy for the blade to pass through the neck region. So this muscle, because it's are considered are muscle of facial expression. All the muscle of facial expression are innervated by facial nerve, and the platysma is one of these muscle that are innervated by the facial nerve. All right, so look at the deep cervical fascia. So the deep cervical fascia, as I said, is just underneath this superficial fascia, and basically act as a collar. It's just support the structure around the neck, so it makes them in a certain compartment. And there are 4 layers that's considered part of this deep fascia. The first one is, we call it the investing layer. The other one we call the tree-trach layer, and the other one we call prevertebral, and then the carotid sheath. We will look at each one of them. So we'll start with the, I'll first of all look at this image. As you can see, the deep cervical fascia basically where the investing layer covers everything. This is number one. You see, it's covering everything. And if we remove the investing layer, we can see each compartment or each region have a fascia. So the one around the vertebra, we call the prevertebral layer. And then the one around the trachea, we call the pretracheal layer. And then the one around the carotid artery and the vagus nerve and the jugular vein, we call the carotid sheath. Okay, so this image showing you very clearly the investing layer. So the investing layer is the most superficial layer of the deep layer. So it's just deeply to the superficial fascia and surround all the structure of the neck. And this fascia, when it meets two muscle, so here in the front, it meets the sternocleidomastoid muscle. It divides into anterior part and posterior part. And here where it meets the trapezius muscle, it's also are divided into anterior and posterior part. So it surrounds them. How about the pretracheal layer? So pretracheal layer is basically in the front and basically located anteriorly and surround very important structure. Surround the trachea, the esophagus, the thyroid gland, and infrahyoid muscles. So all these structures, you can see the trachea here, and you can see the thyroid gland, and you can see the esophagus. All of these structures are surrounded by this layer. And we can anatomically divide this layer into two parts. One part lies in the front, and we call the muscular part. Basically, this is enclosed the infrahyoid muscle. And then the other one, which is more posteriorly, basically, this is enclosed the thyroid gland and it closed the trachea and the esophagus. So we have an anterior part and we have a posterior part. This is the muscular part and this is the visceral part. Okay, how about the prevertebral layer? So the prevertebral layer is basically lies more posteriorly and surround the vertebral column. And basically, you will understand when we talk about the triangle, this layer forms the floor of the posterior triangle. There are other important structures found in this region. You'll see that there are brachial plexus and you have the subclavian artery, and they are more, when they go out of the neck, so they emerge out of the neck as the axillary sheath. I'm sure that you understand, remember the axillary sheath when you took the MSK where we were studying the upper limb innervations. So this is the prevertebral layers. Okay, how about the carotid sheath? This is one of the important sheath, and basically why it's very important, because it's housed very important really vessels and nerve. And basically it's also formed by contribution from the pretracheal and also prevertebral and investing layer. So this sheath have part of the pretracheal and part of the prevertebral. So because there is a contribution for both of them. So important content, as you can see in this image, you have the common carotid artery, and this common carotid artery bifurcate into external and internal carotid artery, and then you have the most important nerve we have for the thorax and the abdomen is the vagus nerve, and you have some lymph nodes. Beside, you have the internal jugular vein. And they also, this fascia extend all the way from the base of the skull to the thoracic mediastinum. This is very important points. That mean any infection, could be a pathway for infection. So infection can travel from this region all the way to the thorax. This is also because this sheath acts as a tube. It can limit the spread of infection to only this region, so it doesn't go out of it. So as I said, the clinical relevance of these fascia, it's limit the spread of infection, and basically If somebody have an abscess in the skin, usually we all us have sometime an infection and superficial to the skin. It's a wound, or somebody have like a cut, whatever kind of infection in the skin. It's prevented from going deeper by these fascia. All right, so we're done with the superficial fascia. So now we're going to talk about the triangles of the neck. The first triangle we want to talk about is the posterior triangle. But let me give you an overview. And you look at the neck from the side here, you can see that the neck is divided by this very important muscle. You see this muscle acts as a landmark here in the neck region. The sternomastoid muscle can divide the neck into two triangles. One triangle is behind this muscle. We call it the posterior triangle. And one triangle is located anterior to this muscle. We call it the anterior triangle. So what we're going to do right now is look at this triangle, the posterior triangle. And you can see this posterior triangle. We're going to talk about it now in the lecture. That it's also further divided into two other triangles. One is called the occipital triangle, and the other one is called the supraclavicular triangle by this muscle, which is the omohyoid. And then also the anterior triangle, when you look at the next lecture, you see that it's further divided into four other triangles. But now let's focus on this posterior triangle. So what's very important for you to know, usually I get asked this question, doctor, what should I know? What should I remember? This is what you should know, and what you expected from you to know. Basically, you should understand the borders for each triangle. You should understand the content for each triangle. And basically, you should understand the subdivision, how it's divided, and what's the importance of each triangle. Because some triangles have some important structure, we expect you to know what could be the clinical problem that can happen if somebody gets an injury. I'll give you example as we go on to each one of these triangles. Okay, so first of all, let's look at the boundaries. Now we are focusing on the posterior triangle. I like this image because it's colorful and can help you, for people that are visual like me, they can grab the image and understand very easily if it's versus if it's one color. So basically, this is the boundary. As you can see, this is a large triangle, and this the triangle have boundaries. So there is a boundaries on the front, which is anterior boundaries, and there is a posterior boundaries, and then we have inferior boundaries, and then we have a floor. This is called the floor. Imagine that we are in 3D world. This is floor, and then anything above this floor is called the roof. So this is the area of the boundaries that we expect you, or borders that we expect you to know. So first of all, the anterior boundaries is basically the posterior border of this sternocleidomastoid muscle. This is the sternomastoid muscle. If we divide the muscle into anterior border, and then we have a posterior border. The posterior border is related to the posterior triangle versus the anterior border is related to the anterior triangle. And same here, you have a trapezius muscle. This is the anterior border of trapezius muscle, but this is related to the posterior border. So now we have a, I know it's confusing because this is anterior and it's related posterior of the sternomastoid, and this is posterior, but it's related to the anterior border of the trapezius muscle. And then you have the inferiorly, you have this, you see this important bone, the clavicle. I'm sure that you remember the clavicle from the MSK. The clavicle can be divided into 3/3. This is the first third. This is the middle third. This is the last third. So the middle third is forming the inferior boundary of the posterior triangle. How about the floor? The floor, basically, we have the, as I said, the investing fascia. The investing fascia cover everything, and then also in the floor, you have also, if you remove the prevertebral fascia, you have some muscle. These muscles are the muscles that are, we call the prevertebral muscles, and there are 3 muscles. I'll show it to you in the next slide. This is related to the neck region. And then finally, we have the so these are the muscles. Let's look at the muscles. So we have the three muscles here. This is the splenius capitis, the first muscle, and then you have the levator scapula. I hope that you remember the levator scapula from the last course, and then, or the MSK, and then you have the triscalenus muscle. You have scalenus anterior, you have the scalenus medius, and then the posterior scalenus muscle. Okay, so you have the spleen, a triscalenus muscle, and the levator, and the splenius capitis. Okay. Very important muscle that are found in this region is the omohyoid muscle. Why the omohyoid muscle? Because this omohyoid muscle divides the triangle into two other triangles. As I told you, one triangle is called the occipital triangle, and the other one, remember here I showed you in the previous slide, one is called the occipital triangle, and the other one is called the supraclavicular triangle. So anything above this omohyoid muscle is called occipital triangle. Anything below it is called the supraclavicular triangle. Okay. Okay. So what are the other structure other than muscle that we can see in this triangle? You have very important vein, which is the external jugular vein. So this is one of the major vein of the neck. So the external jugular vein, you can find them in this region. And then this external jugular vein are found superficially, and it pierces the superficial fascia, and then it crosses over this muscle, which is the sternocleidomastoid muscle, and then it's just empty in the and the subclavian vein. So this is the root of the external jugular vein. And I'm sure that you remember, I don't know if it's mentioned in MSK, that subclavian vein could usually be used as a very important point of, in venous system. If somebody want to have a catheterization for somebody as a long-term, could be a very active or very fast route to go give direct access to the patient venous system. For what are the other nerves that are found in this region? So there are three important group of nerves that we have. One of them is the spinal accessory nerve. The spinal accessory nerve, this is one of the nerves that are found in this region. I hope that you still you remember the cranial nerves and their Latin or numerical number. So this is cranial nerve number 11. And then we have a part of the cervical plexus, and then we have the roots and the trunks of the brachial plexus. So we have the cervical plexus, the brachial plexus, and we have the spinal accessory nerve. All right. Before I dig deeper, let me see, and I want to see how much you are integrating the knowledge together. And this is the kind of things that we expect from you, because the head and neck is all integrated together. So can anybody remember one muscle that are innervated by the accessory nerve? You can type it in the chat box. One of the muscle that are innervated by the accessory nerve. Anybody can remember? Perfect, trapezius. Okay. Okay, trapezius. Okay, so let me give you an example. If somebody, this is kind of question that you can expect in the exam, and also it's kind of question that you see in SMLE. They will ask you that somebody will have a stab wound, or like somebody getting injured, or have a knife that are stabbed in their neck, in the posterior triangle of the neck. So right away, and you see that what kind of a muscle, because they will not tell you that the spinal accessory is injured, but because you know that spinal accessory are found in the posterior triangular nerve, what could be the impact if somebody have a paralysis of the spinal accessory nerve? What could you see the paralysis? What could be the damage or the movement that somebody not going to be able to make? Yes, so the person can shrug the shoulder, right? And maybe you'll have a drop shoulder, okay? Any effect will be in the also the movement of the neck? Yes, moving the head. So the person will not be able to tilt the head or move the head. So they can't move their neck. So this is the example of the, when I tell you guys why we are studying this region, this is the example of things that you are applying what you learn, especially the triangle of the neck. And the most common injury, or the common, if somebody do it, can tell you, maybe they can tell you somebody had an operation in the posterior triangle of the neck. So they have a surgeon in that region. And unfortunately, he have maybe an unskilled surgeon. And during the, after the operation, the person will have an experience some problem with the movement of their shoulder. Okay, and they can ask you what kind of nerve is impacted. You see what I'm talking about? Do you see how you can connect the neck? Guys? No, winged scapula is not related to spinal accessory nerve. Perfect. Okay, so let's move on. All right. All right, so the division, guys, I already talked about it. You can see this is again a color that shows you the omohyoid and how the omohyoid can divide the triangle into occipital triangle and into some people call the subclavian triangle, and some people call it the supraclavicular triangle. Again, anatomy have different name, but yeah, just give you the two name. So you can understand the difference. It's related because this is related to subclavian artery. Okay. Okay. So we're done.